Medicare can feel like its own language, especially with new changes coming in 2026. In this episode, you'll learn what those changes mean, how to understand the basics of Medicare A, B, C, and D, and how to confidently choose the right advisor to guide you through the process.
Welcome to Biz Help for You, the show that saves you the expensive learning curve by providing advice from industry experts in every facet of the entrepreneurial journey. Too many small businesses collapse. According to the U.S. Census Bureau, 20% fail within their first year, and less than 35% make it to their 10th anniversary. The goal of this podcast is to change that statistic. So if you're interested in learning more to be a successful entrepreneur, tune in today.
Whether you're approaching Medicare for the first time or helping loved ones navigate it, today's conversation will give you clarity and practical tips you can put into action. So, Cherie, welcome to the show.
Thank you for having me, Candy.
I'm excited to have you here, and I'm excited too because you're another person I've actually had the chance to meet in person, build a relationship with, and I get to have you on the show. So I'm so glad that you're here today.
Absolutely. I count you a friend.
Thanks. Well, I know as when I was getting to know you and learning about Medicare and hearing some of the things, that go on, I was like, oh, I need to have you on the show. But a lot of people sometimes wonder too, how did someone even get into this industry? It's not like people grow up thinking, oh, I'm going to help someone make Medicare decisions. So I'd love to hear what made you decide to become an advisor for Medicare and insurance.
Thank you for asking that. So my background is actually in education. I was a teacher for 20 years. I taught everything from pre-K to 8th grade. Absolutely loved it. Was very passionate about it. But in 2019, my daughter came down with an illness that caused me to have to be home as a caretaker. She has since recovered, but during the interim of that, I spent some time really doing some evaluation, saying some prayers, and insurance just kept coming up in my mind as something that I should do. And I had never had an idea that I would ever go into insurance. But then on top of that, New York Life called me and said teachers make great insurance agents. So I went to work with them for a while, met my now husband at New York Life. We like to say he mentored me up the road, and it didn't make sense for me to continue to be at New York Life if he was also there. So I ran his office for a period of time. And then one day our partner Blair said, hey, we need somebody to start sending our people to for Medicare. And without even thinking twice, I raised my hand and I said, I'll do it. It just felt like the natural next best move for me. So that was a few years ago. And since then, I've learned a lot. I've done lots of education things with Medicare. And I find that it is a topic that people desperately need to be taught about, which lends itself into my background because I'm a natural educator. I don't mind talking about this and teaching people about this. And I've also had the wonderful experience in the past couple of years where a gentleman or a woman comes and sits in front of me. They're frustrated, they're confused, they don't know what their next step is going to be for Medicare. And even one gentleman was kind of closed, like in his body position, shoulders slumped forward, kind of leaning down, like in a protective sort of stance. And at the end of it, he was leaned back. We were laughing, and he said, boy, that was easy. Thank you for making that so simple. So I think my love for doing this kind of work is the fact that I am still such an educator, and because I understand the need that is out there for people who are Medicare beneficiaries to understand. So that's where I got started, and that's my journey.
Well, and I would love for you first to really touch on what are the basics really of Medicare. I'm sure there's a lot of people who are just now having to sign up for the first time, and maybe they just have heard, oh, well, I know Medicare, it's an insurance and I have to get it when I turn 65, or but they don't really know what it really is, what it really does. So can you maybe just touch on that first?
100%. So Medicare is our government's kind of answer to insurance for seniors. Okay. And when someone becomes a Medicare available, we'll call it, ready for Medicare. And by the way, it's not just at 65. Someone could have ALS Someone could be in kidney failure. Someone could be disabled for over 24 months and they become available for Medicare. All right. So when that happens, then we sit down and that's time for education. Oftentimes someone becomes disabled, they get their Medicare card in the mail and they don't know, what does this even mean? So to simplify things, there are 4 parts of Medicare. Part A is hospitalization. That simply covers the hospital room and your stay. Part B is the medical care that you receive from any doctor, any care that you're going to get, that's Part B. And then Part C, we call it Part C, but those are the Advantage plans and the plans that are facilitated by insurance carriers. And then Part D is the drug plans. And there's all different moving parts there, right? So original Medicare is Part A and B. Typically, when you are Medicare eligible through any of those things that I mentioned, you will go to Social Security or a card will be sent to you depending on the situation. And you will have Part A and you need to sign up for Part B. And once you have Part A and B, that's when you need to make some decisions. If you're on Part A and B, that's original Medicare. You're set, but it's an 80-20 split. So meaning that Medicare will cover the first 80% of your medical bills after a $250 Part B deductible. And then you're responsible for the next 20%, which may seem fine to a lot of people. I caution folks on that just a little bit because I think you need to go one of 2 other routes at that point. We evaluate. It's never anything that I say is best. In fact, I'm not allowed to say best. I won't use the word best. What I do is I go through a needs assessment. I ask people, hey, here are some key questions. Here are some things. Let's make sure your doctors and your medications are recorded so that then we can start to discuss what is the right thing for you to do. If we talk about a supplement versus an advantage plan, and then we make choices. And we have to make sure that someone has that Part D coverage either through an advantage plan or through a supplement so that they don't get penalized for not having drug coverage. So that's kind of it in a big round nutshell. But I have a very simple way of explaining it. So education is something, like I said, that I love to do.
Mhm. Well, I know you mentioned there's other situations that could have someone be able to qualify earlier, but assuming someone is turning 65 now and they're going to have to sign up, I guess one of the questions I have is, do they have to do it like, oh, this is the month you're turning 65, so you have to do it? Or is it within that year they have to sign up? Like, when does that actually become like, oh, you have to do this by this deadline to make sure that you're doing everything properly?
That's a great question. Thank you for asking. So you have 7 months. And your initial enrollment period begins 3 months before your birth month. Then you have your birth month, and then you have 3 months after your birth month to make your choices with Medicare, to make sure that you're signed up for Part A and Part B, to make sure that you have a Part D drug plan, again, either through your Advantage plan or through your supplement. And as long as you are signing up within that 7-month window, then there will not be any kind of penalty given to you. But if you miss that window, there are some penalties that will start to incur. So we definitely want to do that. And honestly, the very first step is Social Security office. So you go to the local Social Security office or you do it online. So that's really what you need to know when you're turning 65. And you definitely want to meet with someone in person. Please don't answer what I like to call 1-800 who cares, that's calling you and offering you benefits that are oftentimes, first of all, it's not legal for them to be calling you without your permission. You need to know that. And I recommend you work with a broker who is with several carriers and not just one, and who can give you really good, solid advice that is not going to be based on any kind of particular carrier.
Mhm. So if someone has a regular insurance plan and now they're turning 65 and they have to make this decision, does like their insurance just like automatically end saying like, oh, now you're 65, you should be registered by the fourth month, after, or the third month after your birthday. And so now we just don't even have coverage, or how does that work? Do they have to actually cancel their coverage? Like what happens with the regular insurance versus they're signing up for Medicare now?
Another great question. So if it's work insurance and it is what we call creditable, which means it covers your doctor's visits and it also has drug coverage, you actually are not required to sign up for Medicare Part B. You can keep your work coverage and it does not automatically cancel. Now, I will caution folks, some companies, in fact, one that I could name, but I won't, that's our major corporations, will in a way push you out. So they'll say, congratulations, you're retiring. Retirement's another key there too. You're retiring. And so rather than having this work insurance, it's ended now that we have ended that partnership, and you will immediately need to go look. But so retirement can be at any age past 65. Sure. If you're 70 and just retiring and you've had creditable work insurance, then that initiates upon your retirement a special enrollment period. It's very important you work with someone who knows the special enrollment periods. And you can there's a form that you'll fill out showing you had the creditable insurance before that. And that initiates your what we call IEP, initial enrollment period, to start at that point. Now, the other caveat is if you're on ACA marketplace insurance, when you turn 65, you must go to Medicare. So that is another thing to keep in mind there. But the automatic ending of work coverage does not happen. You get the choice typically between work insurance and going to Medicare.
Okay, perfect. Well, I do know, I hear too that Medicare things are changing and they always have to make choices every year, where if you have regular insurance, usually it's the just same thing year after year unless they make some kind of major plan change. So I'd love for you maybe to touch on why is it that they have to make these decisions every year?
Well, I appreciate that question. And I'll have to tell you, there are, without getting into all of the acronyms and the confusing part behind the screen, right? We'll just say that there are programs that start every year, programs that end every year. Last year, we had a big matchup with Medicare where suddenly the plans were required, the Medicare Advantage plans were required to cover prescription drugs after $2,000 out of pocket spending. Up until that point, the patient, the client, the beneficiary had to cover up to, I believe it was 8,500. There was a donut hole time in which they covered all of it. And you had to know the idiosyncrasies of how all of that worked. Well, the government said, hey, we'll solve that for people. Plans, you now are going to cover anything over $2,000. And it created such a mix up because suddenly it sounds really great, but some medicines weren't covered. Some plans, it caused them not to offer some of the benefits that beneficiaries were used to receiving. So we had to make lots of changes, lots of side by side comparisons. This year, we are seeing some other changes coming. I can't speak to plan specifics. I can say there will be an amount raised in that $2,000 amount that the beneficiary pays for. Now it's $2,100. And there will be drug deductibles that are going to be on plans this year. They were last year as well, but they have also gone up. So another thing that we're going to see are changes in the benefits. I wish I could go deeper into that, but I just can't at this recording time. And I just want to make sure people understand that to sit down with someone who has your best interest in mind, that you can see face to face, either with Zoom, or you trust them and you can do a recorded phone call, or you don't mind to come into their office, you are at a benefit. Especially when that person is a broker, because he or she can sit down, look at the plan you currently have, and one time at the year during October 15th to December 7th, you can make a variety of different changes. You can go from a supplement or an advantage plan back to just original Medicare with that Part D, or you can go from original Medicare with Part D into an advantage plan, or if you qualify with health, depending on the time that you're doing it, you can go into a supplement.
Mhm.
So many changes that you can make, but you really need that guidance then.
Mhm. So, are there any specific changes for 2026 that you can mention now that beneficiaries and families should be aware of? Or if not, like what is the date that they can find out what those changes are so they can start their planning?
And so they can start finding out after October the 1st. And the best ways to get in touch with an agent. I will say, yes, you are seeing benefits within the plans changing. That much I can say. Some requirements are in place that they just haven't been up to this point. So you need someone to be able to talk to you about what your plan is now going to require for you to do in order for you to keep your benefits. So a lot of
Mhm.
times people want to just set it and forget it with their insurance, just like they would, and it makes sense, just like you would with your car insurance, just like you would with your home insurance, just like you would, lots of other things. You're just going to set it and forget it. Typically, people aren't out here every year changing their phone plan, for example.
Mhm.
But with Medicare, it's very important that you don't do that because your plan may have some changes and you might see, well, I see that this benefit is going down. No big deal. I can handle that change. Yes. But in order to get said benefit, there might be, and there will be in 2026, some required steps for you to have to go through in order for you to receive, say, a food card, for example, or maybe you're used to getting monthly over the counter. Or maybe you're in a dually enrolled plan and you're used to getting certain benefits. Well, now there's a step that your doctor may have to do in order for you to get your benefits at all. So it's a changing time. And you
Mhm.
definitely want to make sure that you're set on a good plan that covers you. Don't set it and forget it.
Mhm. And I know traditional insurance too, there could be an individual plan or you're on with your family or, again, it could be with your work or something like that too. But is Medicare just considered like it's individual for each person, even if it's a married couple? Or is it still kind of together and they're on a plan as husband and wife? Or how does that work?
I'm so glad you asked that. So I'm thinking of a couple I have in mind. I won't name them. The husband is extremely healthy, typically doesn't go to the doctor. So he signed up for a plan with one company that I represent. It's a give back plan. So it gives back some of the Medicare Part B back to his Social Security card, and he does have some coverage. The wife in this scenario did have a health issue that she needed to make sure that she got checked. So benefits were extremely important to her. She went with a traditional style of Medicare Advantage plan that had more coverage for the need that she had. And we
Mhm.
talked through how that no, in fact, you don't have to, as a couple, be on the same exact plan. In fact, one may choose to be on a Medicare supplement to cover that 20% and to just sort of, with a supplement, kind of call that pre-buying your healthcare coverage. You pay a monthly fee and then typically depending on the letter of the supplement that you want to pick the Medigap plan. It's also called Medigap plans. You may not have bills at all coming except for the 250 in the Part B deductible. But it just depends. It's case by case. And so it depends on a person's health. It depends on a person's risk aversion, right? It does depend on finances. And so it's not the same as work insurance where you're probably going to be on the same plan.
Mhm. Well, and I was wondering, and you just happened to mention finances just in that last sentence. And one of the thoughts that I had too was, is there like a dependency based on if you make so much income, you pay so much for this, or is it still like traditional insurance that as you age, it's just so much per, year of life or whatever? Like, how do they figure out what the pricing really is for those plans?
So Medicare Part B has a set cost every year. And that is dependent on income in the sense that they have a scale, and if you make a certain amount above the base, then it could be more each month. Someone who is a licensed broker can help guide you with discovering what your Part B will be. Okay. On the
Mhm.
flip side of that, if you have low income, there are programs like a low income subsidy that you could apply for that would help you with your drug costs. Medicaid and Medicare, if you qualify for Medicaid at a variety of different levels, it allows you to potentially have that Part B paid for. It allows you to be in a plan where it marries Medicare and Medicaid. A lot of times your medical bills are very, very little. And a lot of times, some of those plans will give you food cards, help with utilities, transportation in some cases. So plans are, yes, built so that you can look at some income scenarios, and if someone has very, very little, there's ways that you can get your insurance at a lower cost. And if someone is a high income earner, there is a scale that we can look at to determine what their Part B cost will be. So in that
Mhm.
sense, yes, some of it is taken, income is taken into account.
Mhm. So I'm also thinking too of a lot of families now that grandparents are raising grandchildren and, they may be the age where they're supposed to be on Medicare too. So does that mean they still have to have their plans and now they have an individual plan for their dependents? Or how does that work if they have dependents that they're caring for and it's not on a regular insurance plan?
Thank you for that question. I can refer to this very easily because it's a situation in which my parents are in, actually. They are both Medicare beneficiaries. They receive their Medicare through a plan, and then the children are actually Medicaid beneficiaries because of a scenario that has happened where they're raising the children because of my sister's death. There are plenty of times, though, in which that is not the case, and grandparents are raising grandchildren for whatever the reason is. It may not be a financial need. In that case, we can look at several options for the children, but the grandparents still need to be on Medicare. So there's not a situation in which they're going to buy a plan and they're going to pop these grandchildren on the same plan with them, not in Medicare. One of them might have work insurance still be working. In that case, of course, they can cover the kids. So again, that question is a good one, and it's very individualized. For the most part, they are going to go on Medicare, and the kids are going to need their own separate insurance coverage, which can be attained.
This just seems like there's so much information. It could be so overwhelming. And I know that's why you've said multiple times too, you really should talk to an agent and have someone, who can sit down with you and really go over this, or an advisor, I guess, not agent necessarily. But are there any like questions you recommend that if they are going to sit down with someone like you, that they make sure they have those answered? I assume, someone like you would know the questions and make sure you answer those for them too. But do you have any recommendations of some they should jot down to make sure that they're asking those questions to help them make the best decisions?
Well, a certified or a licensed Medicare advisor, that is a license through this whatever state they're in, and has passed a national insurance producers test. For instance, I do the AHIP, American Health Insurance Producers exam, every year, specifically with Medicare questions, right? It's it's not so much that the beneficiary has to come prepared for questions as much as the advisor needs to do a needs assessment. Legally, we are required to ask certain questions in our meeting. We have a list that we have to follow. There's a guideline for what we say and how we say it for what we take our clients through. But on the client side, I would say I would ask I would ask about that person's certifications and maybe how long they've been doing this. B, I would ask if they're a broker or if they're just representing one company. And then C, I would come prepared with my red, white, and blue card if you're ready to make your choices, and questions that you have, maybe that you've jotted down about the parts of Medicare, and come expecting your advisor to have those answers, either readily or a quick lookup, but to have resources that he or she can find to get all of your questions answered. You never want to sign anything unless you're 110% confident in the person who's helping you and also in the plan that you've got. Please don't just accept 1-800 who cares calling you randomly and getting confused, please hang up on them. Do not talk to a random 1-800 number who has called you. In fact, they're, like I said, legally they're not allowed. So you prepare your questions. We're always happy to take any question the beneficiary has. And again, we're prepared to answer them, and we're prepared to ask our own questions so that we're 100% sure this person is now on the plan that is right for them.
Mhm. Wow, there's just so much. I had one more thought too while you were talking
Yeah.
about that and the plans, and I'm thinking if someone makes a choice and then later on
Mhm.
they realize like maybe this wasn't the best for me, are they now stuck in that plan until the next year, or is there like a certain period of time where you're like, oops, I made a mistake, I want to change? Like, how does that work?
So there's lots of special enrollment, but also during annual enrollment period, you're allowed to make another change. So if it is October 15th, you meet with your broker, you look and you decide, hey, that's the right plan. But then maybe Sally Sue, your neighbor, asks you about this plan that she's just discovered, and you want to go sit back down with your advisor, you're allowed to do that. Some periods allow you one change, just depends on the time period that you're in. And then there's also a period of time from January to March. We're not to advertise that, but I can speak to it. And that is an open enrollment period after annual enrollment period happens. So annual is October 15th to December the 7th. And then open enrollment is January 1 through March 31st. That time is set there for anyone to go from a Medicare Advantage plan to another Medicare Advantage plan. So it's kind of like, think of it as a trial period. You've picked an Advantage plan, and now you're going to the doctor, now you're looking at bills, now you're thinking through the usage, that you have, or maybe now you regret not choosing plan B over here for something, or with this Medicare business or company carrier, and you've heard about that plan. You do have that freedom during open enrollment after annual enrollment to switch your Advantage plan to a different Advantage plan. But there are time periods and built-in times when you can make a single change, and that all depends on the time that you're sitting down and talking to the person.
Okay. Well, this has been informative for me too. I'm not quite there yet, having to do it, but just being able to have the information and to share it with those who are listening, for those who are having to maybe do it for the first time, or maybe they're coming up on having to make those changes. So I appreciate you being here and talking about that, but I know we're running out of time. So I wanted to ask, do you have an offer that you would like to extend to our listeners? And if they want more information, how can they contact you?
Okay, thank you. The offer really is simple. Meeting with me is absolutely free. Any questions they have, I'll answer happily. Currently licensed in the state of Tennessee and Virginia. If someone did need help outside of those states, I do have other agents that I could refer them to within my organization and make sure that they get the help that they need. In addition, I do life insurance, I do cancer plans, vision, dental, hearing, a wide variety of coverage items. And again, working with me is free. I never will ever charge you anything. So as far as an offer, call me within so long and you get XYZ. No, I don't have anything like that. Just knowledge to give, and it is free. And the way that you get in touch with me, I do have a website. It's insurancewithcherie.com. But also, my phone number is really best, 423-503-1474. And then you can look me up also on Facebook. It's Cherie Clough, Medicare Advisor. You type that in, it'll come up. My last name is spelled Cloughh. It's Clough like tough. I get called everything. It's not Clow or Clue. But I think at this point I would just answer to hey you, and I would be like, oh, you mean me. But 423-503-1474 is the best number to dial if you're needing that kind of assistance.
Perfect. Well, thank you so much for being a guest on my show, Cherie. I really appreciate your talking on this topic. I know it can be confusing, and I really wanted to make sure people understood, what was happening and how to make those choices. So thank you so much.
You're so welcome. Happy to be here.
And to the listener, if you enjoyed today's topic and you want to hear additional information, you can find access to exclusive content in the show notes. Thank you for tuning in today. Would you please share this episode with those you know and leave a review on your favorite platform? And if you find our show informative, would you consider being a financial sponsor to help me continue my mission to educate business owners? A link is located in the episode description, and no amount is too small. I'd really appreciate your support. If you are interested in connecting with our guest and receiving the offer they had to share, a link to our resource page is in the show notes. Finally, if you have any bookkeeping or payroll needs, reach out to us at 310-534-5577 or contact@abandp.com. My team and I are eager to assist you. Until next time, have a great day.
Thank you for listening to Biz Help for You. Please join your host, Candy Messer, again next time. Have a terrific day.